Hello, my name's Arron. I'm from Belmont Chiropractic. This is just a really quick video on Trocanteric bursitis or Trocanteric bursitis or greater trochanteric pain syndrome. All these cool names. So I've recently had a few folk asking me what this is because they've been told they've got it by their GP or some sort of other therapist and that's what they need to be treated for. Now, a lot of people have this thing. I don't really ever use that phraseology or that terminology, I should say, because I just don't find it particularly useful to give people a whole bunch of names to call their thing. I just like to fix the thing. But let me explain what it is. So I've got my little friend here, Seymour. So your trochanteric bursa, what it does, this guy doesn't have any legs, but if he did, his leg would be hanging down here and there's that lumpy bit that sticks out the side of your leg, you know, like this bit. Now, that little lumpy thing there is called a trochanter, and that's what we're talking about. And every time you take a step, every time you move, there's a few tendons that flick over that sticky out bit of bone. Now, the purpose of that bursa is to act as a little lubricator there so that your bone doesn't essentially shred that tendon, because every single step you take, that thing's just juk the whole time. And when you've got something going on with your lower back, let's say this joint here gets jammed up, this is your butt back here, so you're facing that way. This joint here gets jammed up. Suddenly, instead of walking like this guy doesn't move. So this one here can move, and this other guy here is stuck. So suddenly that tendon is flicking past this in a way that it's not designed. All right. Now, because of that, the whole system starts to become inflamed. Now, the inflammation can happen on either side. It actually doesn't really matter, but the GP or the therapist, whoever it is who likes to diagnose the spot that it hurts, is going to say, you've got this trochanteric bursitis, that's your problem. I kind of look at that as a diagnosis, as saying your car's got engine noise. It suggests something's wrong, but it doesn't give you any idea as to what that something may well be. So, well, and I do care where the pain is, but it doesn't really influence what I do. My job is to hunt down the dysfunction, fix that, and then that bursa will get better because suddenly the tendon is striking it in the direction that it's designed, not some other sort of random direction. So yeah, so either way, I guess in summary, trochanteric bursitis is simply in the name of a symptom. It's not a disease process in of itself. A chiropractor does not treat trochanteric bursitis, but we do look after low backs, and as a low back gets better, things like trochanteric bursitis do as well. Cool. That's all I got to say about it. I hope that makes your afternoon a little nicer. Bye.